Welcome back to Now Media's TV show, Pain Diaries, broadcasting here in Houston, Texas on Channel 2110. We are back taking a deeper dive into spinal cord stimulation for low back pain. Now, this is a procedure which is one of my favorites, as well as my partner's favorite, at Performance Pain and Sports Medicine, as it allows people to take a test drive first to see if it will be life-changing for them. You get to try it before you buy it. That's the name of the game. As you know, Pain Diaries is to help people understand the options that are available for treatment. There's so many amazing new technologies, and spinal cord stimulation is one of these treatments that changes people's lives, and it's been around for over 40 years. So let's talk about spinal cord stimulation, an effective treatment for chronic pain. As you know, chronic pain is a common condition that affects many people all over the globe. As we've discussed, the condition of chronic pain can be caused by various factors such as injury, illness, or even nerve damage, and it can significantly impact a person's quality of life. The pain can be so severe it interferes with daily activities, making even simple tasks like walking or sitting unbearable. While traditional pain treatments like medication and physical therapy can provide some relief, they may not work for everyone. In such cases, spinal cord stimulation, or SCS, is a safe and effective alternative that's helped many people find relief from their chronic pain. Spinal cord stimulation involves a small device that's implanted under the skin in the low back and up into the spinal area. The device sends electrical impulses to the spinal cord, which alters the pain signals that travel from the nerves all the way up to the brain. This can reduce the feeling of pain and provide relief to the patient. Spinal cord stimulation involves a trial period, again, during which a temporary device is implanted to ensure the patient experiences relief before a permanent implant is then put under the skin. Spinal cord stimulation can be used to treat various conditions that cause chronic pain, such as failed back surgery syndrome, complex regional pain syndrome, and neuropathic pain. Most recently, it's gained FDA approval to treat diabetic peripheral neuropathy, which is a painful burning sensation in the feet. It's also used for non-surgical low back pain in the more recent years. It's commonly used to treat chronic pain in the arms and legs, as well as other areas of the body. In Europe, it's even approved for some other indications, such as treatment for chronic angina or chest pain. The benefits of SCS are numerous. Unlike traditional pain treatments, SCS does not involve medication and has minimal side effects. It is also reversible, which means the device can actually be removed at any time if the patient no longer needs it. Moreover, spinal cord stimulation has a high success rate, with many patients reporting a significant reduction in pain with their levels, as well as improvement in the quality of life. Unfortunately, this is an underutilized treatment. Many primary care doctors do not even know about it or understand how it works. In conclusion, spinal cord stimulation is a safe and effective alternative for those who suffer from chronic pain and have not found relief from traditional pain treatments. With a high success rate and minimal side effects, it can significantly improve a patient's quality of life. If you or a loved one are suffering from chronic pain, talk to your doctor or ask for a referral to a pain management physician to determine if spinal cord stimulation is right for you. So let's talk a little bit about how does spinal cord stimulation actually work. Spinal cord stimulation is an innovative and effective treatment for chronic pain, and the procedure actually involves the implantation of this small device under the skin. It goes near the spinal cord, and then the device is connected to wires that carry electrical impulses to the nerves in the spine. These electrical impulses help disrupt the pain signals that are transmitted all the way to the brain, reducing the sensation of pain. The intensity of the electrical impulses can be adjusted to meet the patient's individual needs, and the device can be turned on or off as needed. The patient's in full control of their device. The procedure typically involves that trial period, where a temporary device is implanted to ensure the patient experiences relief before a permanent device is implanted. During the trial period, patients are encouraged to keep a pain diary to track their pain levels and the effectiveness of the treatment. The functional outcomes are also important, as people usually state they slept better, they were able to walk longer, or even stand longer, and they were in a better mood. This is always related to the patient or caregiver's relay of information. This data is then used to determine if the permanent device will be implanted. Spinal cord stimulation can be used to treat various conditions that cause chronic pain, such as neurologic pain, neuropathic pain, complex regional pain syndrome, failed back surgery syndrome. It's also commonly used to treat chronic pain in the arms and legs and other areas of the body. The benefits of spinal cord stimulation are numerous. Treatment does not involve medication but electricity that is dosed and has minimal side effects, making it safe and effective as an alternative to those who cannot tolerate or do not respond to traditional pain treatments. Additionally, spinal cord stimulation is reversible, which means it can actually be removed at any time if you no longer need it. Spinal cord stimulation is promising, and it's been around for a long time now, but this is great for options for chronic pain sufferers. The procedure involves, again, implantation of a small device sending electrical impulses to the nerves of the spine, reducing the sensation of pain. The trial period ensures effectiveness with minimal side effects and a high success rate. Spinal cord stimulation is safe and effective, an alternative for those who have not found relief from traditional pain treatments. So who's a good candidate for spinal cord stimulation? Usually, it's often recommended for patients who have chronic pain that has not been managed effectively with other treatments, and it can be used to treat a variety of conditions. Diagnoses include failed back surgery syndrome, complex regional pain syndrome, which is abnormal sensation after somebody has an injury or surgery, chronic neuropathic pain, arachnoiditis, peripheral neuropathy, diabetic peripheral neuropathy, low back pain or non-surgical low back pain, spinal stenosis, and nerve pain in the extremities. Before undergoing spinal cord stimulation, patients will need to undergo a thorough history, physical exam, as well as a psychological evaluation for an implantable device to determine if they are a good candidate for the procedure. So let's talk about the procedure. Spinal cord stimulation is a procedure typically done on an outpatient basis, which means patients can go home the same day. During the procedure, the device is implanted under the skin near the spinal cord, and the patient then will undergo a trial period where the device is turned on and off to determine its effectiveness, and different programs are put in the device. If the trial is successful, the device will be permanently implanted. Usually the trial is done in an office, and the implant's done in an operating room type setting. Spinal cord stimulation has several benefits, including reduced pain, improved quality of life, reduced dependence on pain medication, and fewer side effects compared to traditional oral medications. As with any medical procedure, there's some risks associated with spinal cord stimulation. These can include infection, bleeding, device malfunction, allergic reaction, and sometimes even lead displacement. But we do everything in our power to prevent these types of complications from happening. It's important to discuss the risks and benefits of spinal cord stimulation with your doctor to determine if it's the right treatment option for you. In conclusion, spinal cord stimulation, safe and effective as a treatment option for chronic pain that has not been effectively managed with other treatments. It works by interrupting the pain signals and can provide significant relief for those who suffer from chronic pain. While there are risks associated with the procedure, they are relatively low compared to the potential benefits. If you are interested in learning more about spinal cord stimulation, make sure you talk to your doctor to determine if it's the right treatment option for you. Welcome back to Now Media's TV show, Pain Diaries, broadcasting here in Houston, Texas on channel 2110. We are back to talk with Dr. Jackie Weisbein, talking about Abbott's full neuromodulation spinal cord stimulation portfolio. We'll be discussing the recent FDA approval for Proclaim XR spinal cord stimulation system indication to treat painful diabetic peripheral neuropathy, also known as DPN, and the Eterna SCS system. Dr. Weisbein is in Napa, California, where she works at Napa Valley Orthopedic Medical Group. Thank you so much, Dr. Weisbein, for being with us today on the show. We're excited to have you here.
Thank you so much. I'm going to call you Suzanne because we've known each other for so long, thanks to working on so many national boards together. So thank you for having me. I'm so excited to talk about one of my favorite topics.
Yeah, I knew you'd be perfect for this topic because you are so passionate about it. Although you're on the West Coast, I'm on the Third Coast. We've really had a chance to get to know each other over the past few years, and I'm so grateful to call you one of my friends and colleagues. We're a small group of women physicians on the board of Women Innovators in Pain Management, WIPM, and we banded together a few years ago to help represent and mentor other female physicians in our male-dominated field.
I think you probably said it more eloquently than I could have. I love how much passion our colleagues have, and I think, with our group of women physicians, we've really tried to continue to extend the reach of our, small little towns that we live in and big cities that we live in to beyond with this kind of messaging. And so thank you again for having me. I can't wait to talk about this topic.
Absolutely. So let's dive right in. How do you actually explain spinal cord stimulation and how it works to relieve low back pain to patients that you see in your office in Napa?
Well, I think the one thing to really think about is that, even physicians who are practicing don't always know so much about these kind of therapies. And in reality, spinal cord stimulations have been around since the late 1960s. So for over 50 years, we've had this therapy, but it's still something that's really unknown. When I'm talking to my patients about it, I like to use things that they can relate to. I think everybody's familiar with a pacemaker for heart issues. And so when I talk about spinal cord stimulation, I like to kind of liken it to a pacemaker for your nerves. If you think about the fact that our body is just using these low threshold electrical signals to talk about, electricity to power muscles or give us sensation, what we're using spinal cord stimulation is to kind of reprogram or help those nerves that are maybe misfiring or sending inappropriate sensations to the body, so that we can reprogram it with a imperceptible spinal cord stimulation or electrical charge, so that you don't actually feel the pain as badly as you might be perceiving it. Abbott, the reason I've worked so long with Abbott is because actually in the last 11 years of my practice, I've found that Abbott has put so much energy into clinical research, specifically around the waveform. Abbott has a proprietary waveform called burst DR, which is essentially a non-linear charge accumulation. So instead of this chronic electrical signal being sent to the brain that might allow our spinal pathways to kind of become used to that stimulation, it has this non-linear charge accumulation that is basically dispersed, and then there's a quiescent or quiet period where there's no signal being sent. And during the time, that body is still receiving the benefits or a carryover benefit while it's not actually receiving any kind of stimulation. In my opinion, this is great for patients with both back and lower extremity pain, and also trunk and upper extremity pain as well.
Yeah, I mean, I've had great success with Abbott's Burst DR as well. I know if I try to explain that to patients, sometimes they're like, oh, do I feel like I'm going to burst? So, the cool thing is it's a waveform, right? But the patients don't actually feel that per se. It's at such a high frequency that our bodies aren't perceptible to that kind of feeling. So I think that's...
Interestingly enough, though, Abbott's actually at a low frequency. So it's actually really low so that we don't perceive it. But the one thing that I think is really beautiful too, Suzanne, is that, up until the last few years, we only had tonic stimulation, which was something that patients would feel, which is why a lot of patients would get coverage, but not necessarily be successful. And now with these new therapies that do not have any kind of perceptible sensation, patients tend to do much better and have a lot more success.
Right, I'm sorry, I misspoke, but yes, it's non-perceptible. So low frequency, high frequency, our bodies just don't perceive it, so no, they're not going to burst, which is great.
Absolutely not bursting.
But yes, pain relief, functional improvement, and hopefully those signals and what we've seen in your practice and my practice, it's targeted where you can actually hone in now on the low back. Whereas in the past, it was more just extremities and you're able to get the nerve pain. But really targeting the low back now with different frequencies has been really a great addition to this therapy that's been around for, like you said, 50 years or so.
Yeah, and compared to the traditional treatments that we've used in the past for chronic low back pain, what's really nice is that those symptoms, or those treatments rather, are just kind of management of symptoms and only kind of temporarily reduce patients' pain. When we think about long-term pain management for patients, there is not a ton of data to support the things that we've been doing. And that makes it really difficult. And then essentially there's a time when patients may stop responding to injections or therapy or medications. And so having options for patients that have been suffering for long-term pain from their back is really important. And before this non-perceptible stimulation, we couldn't really use spinal cord stim for that because the way patients would perceive it would be too intense in their legs for them to actually perceive that in their back. But now this allows us to really treat patients with low back pain. And I think that Abbott has done an amazing job of actually doing some clinical trials to demonstrate the efficacy of spinal cord stimulation for patients with both chronic surgical low back pain and also non-surgical low back pain, which for a long time, we didn't really have long-term treatment options for patients for that.
No, it's true. And I've tried to, I always try to get patients approved for spinal cord stimulation if I deem them as a good candidate. Unfortunately, some of the insurance companies still don't actually accept the non-surgical low back pain as a diagnosis, which is unfortunate because, like you said, there is great data now surrounding that. I recently had a peer-to-peer on the phone and I said, hey, can I send you the papers? Like, this is actually a legitimate diagnosis to help my patient. And they were like, well, it's experimental on this certain insurance, but sure, you can send the papers. So hopefully we can change that in the future because there is so much data coming out regarding non-surgical low back pain now as a treatment. What are
Absolutely.
some of the other things that you determine a patient to be a good candidate for spinal cord stimulation? What do you look for?
Really great question. So I'm thinking about spinal cord stimulation for a lot of my patients. I don't necessarily think that every patient needs to have a device implanted in them. Let's be honest. I'm not the Oprah of spinal cord stim, like you get a stim and you get a stim. But I think, if patients are looking for a really elegant way to control their pain that doesn't require a lot of input, doesn't require a lot of intervention with the frequency that taking a medicine does, or having multiple injections on multiple basis, the recovery is really short. So when I think about these patients, I'm thinking about patients who have chronic pain of both the trunk and the extremities, who have failed to respond to conservative care. Now, we are looking at both patients who have had surgery, who haven't had surgery, who have had issues with their peripheral neuropathy from diabetes, patients with peripheral vascular disease. In my opinion, anybody is really a candidate as long as their other medical comorbidities are well managed. So if you're diabetic, as long as your sugar is well managed, you're still a great candidate. Similarly, a lot of patients worry like, oh, well, I'm depressed. Well, the reality is that this spinal cord stimulation that Abbott has with Burst DR works on both the medial and lateral pathways. So not only is it affecting change with regard to the perception of pain, it actually helps improve mood. And let's be honest, when you're in a lot of pain, you're limited in your activities, and that affects your relationships with your friends and family and loved ones and how you go out in the world. So if we can use a therapy that does not affect your mentation, does not change the way that you process everything, like food and beverages, does not stop you from going and doing all the activities that you love, except for maybe jumping out of a non-pressurized airplane or going scuba diving beyond like 100 feet. The reality is this is a beautiful way to give patients pain relief, and it doesn't alter their physical body. So like when you think about it, if you have surgery, your body is now altered. And when we think about that, I think a good example is like if someone has to have their gallbladder taken out, nobody says, well, if you don't like it, we'll put your gallbladder back. Similarly, if you have back surgery or another kind of surgery for like a hernia or something, when you have that surgery after it, you are changed forever from that surgery. And you can't be put back together the way you were before that surgery. Now, I'm not saying that back surgery or having a hernia repair or a gallbladder removed is not an important thing to consider when it's indicated. But the reality is if you have chronic pain, having something that can continually monitor and manage your pain without it changing your physical body is, in my opinion, a great option for the majority of patients out there.
Oh, I completely agree. And that's why I love it too. I have the discussion, we're not changing the architecture of your spine. We're just, adding something. And if it's not effective, or if something happens and you have to have it out, it's completely reversible. And I loved, to put people at ease with that. And like you said with the mood and everything too, I'd like to put them at ease and say, listen, you're frustrated. You're annoyed that you can't do your regular daily activities because the pain's limiting. It's limiting your function. It's limiting what you can do. It's how you interact with your kids or your grandkids. You can't get on the floor and like do what you want to do with your grandchildren potentially. And you know, the whole point is to help improve your mood. And so when your pain's relieved, of course your mood improves. And the way Abbott's system works, like you said, on the different pathways also helps that. And so I make patients aware, like, yes, you have to have a psychological eval to see if you can be approved for the device, but I don't think necessarily your depression is severe enough where it's going to limit your pain or ability to have a device, because it's more of a situational situation.
100%. And, you know, I think speaking to that idea too of how it limits our function and being able to participate in our life, you know, what I love also about working with Abbott's system is that their Proclaim XR system, as well as their new Eterna battery, are both designed for people who want to live their life, right? So you don't need to spend hours charging. The Proclaim Plus system is recharge free. So in Northern California, we have a ton of fires and bad weather. You're at your home and you're like, oh my God, I got to figure out where my device charger is. It could prohibit you from leaving in a timely manner. Or how do you make sure that your charger is in your go bag? But with the Proclaim XR system and Proclaim Plus, the reality is you don't have to have any charging at all. Now, recently, Abbott has released also the smallest footprint battery in the market, the Eterna battery. And it's amazing because what is really nice about it is that not only is it able to run the Burst DR system, but because of the low energy requirements of Burst DR, this battery only really requires to be charged about 5 times a year. So that means that that patient is still able to go out and do all those things like participate in family activities, play with their kids, play golf, do all the things that they love. And both of these are still available to be implanted. And patients always worry about, well, what if I need an MRI? And because of this, Abbott is really proud to announce that they also have their TotalScan MRI technology in both their devices and leads, so that patients who have these implanted devices are still able and eligible to get full body MRIs.
Yeah, that's fantastic. Thank you, Jackie. Anything else you want to add about the Abbott platform?
I just want to say that I think, you know, in my opinion, any platform that is going to give patients pain relief is really beautiful. I have a predilection for using Abbott because I've had some great success and I participate in a number of their clinical trials. And so my bias to this is particularly because of my own experience. But I think that for any patient out there, if you have a physician that you're working with, you know, discuss with them what kind of spinal cord stimulation they use. Again, Burst DR and the Proclaim Plus and Proclaim XR and Eterna system is only available through Abbott. But again, this is a therapy that's been around for over 50 years, and plenty of really talented physicians out there in the country are using spinal cord stimulation to help their patients. So I would encourage you as a patient that if you have chronic pain that has been refractory to every conservative measure, please talk to your physician about spinal cord stimulation, because honestly, it's the only thing that you get to test out for a week. I tell my patients, you're going to have this trial, and during that week, you're going to test it out. And if you love it, it comes out at the end of the week. If you hate it, it comes out at the end of the week. And really, what other thing in our life do we get to test out for a week before we get to decide if we want to do it forever? So in my opinion, again, I think this is a great thing for any patient, and I encourage them to talk to their doctors locally.
No, that's fantastic. Yeah, try it before you buy it, just like a car.
Right.
Well, thank you, Dr. Jackie Weisbein, for all this amazing information about spinal cord stimulation with the Abbott platform. I am so happy you were able to join us today for this interview. And if you're looking for an amazing pain doctor in Napa, California, Dr. Weisbein comes highly recommended.
Thanks, Suzanne. I really appreciate it. And I hope you and your patients have a great day today.
Thank you. You too. I'm Dr. Manzi with Performance Pain and Sports Medicine in Houston, Texas. And this is Pain Diaries. Take care of you so you can take care of business.